Hi, I'm Dr. Michael Braccio, and I'm a chiropractor in private practice in Seattle, Washington. I wanted to make a quick video on the rehabilitation management of Achilles tendinopathy. As the pathology of tendinopathy has transitioned away from the inflammatory model and towards the load-based model, the emphasis has been on exercise, and most of the research now for the treatment of these conditions focuses on exercise and load management. The exercise program can be divided into 3 different stages. The isometric stage is the first stage. For Achilles tendinopathy, that would be a heel raise held for 30 to 45 seconds. While these isometric contractions have been shown to have a pain relieving effect for the patellar tendon, they haven't been shown to have that same effect for the Achilles tendon. However, the low load of an isometric contraction is a good starting place for those with severe Achilles pain or if they're experiencing some fear avoidance behaviors. The second stage is a concentric, eccentric loading program. For the Achilles tendon, the most commonly used is the Alfredson protocol, which just focused on the eccentric muscle contraction. What the protocol entailed was 3 sets of 15 reps of heel lowers of both a straight knee and a bent knee variation, and each eccentric muscle contraction was over a 3-second span. However, another protocol called the heavy slow resistance protocol has been shown to be just as effective as an eccentric loading program. The heavy slow resistance protocol consists of 3 different exercises. There's a seated calf raise, a seated calf raise in a leg press machine, and then also a standing calf raise. The program starts off with 3 sets of 15 repetitions and slowly decreases the amount of repetitions while increasing the sets as the weight increases. Of note, this program doesn't isolate just the eccentric contraction. They do the concentric and eccentric contractions both over 3 seconds. The third stage is the plyometric stage, and this is important for the Achilles tendon because we want to make sure that it can tolerate quick amounts of load applied to it, such as when we run. The actual exercises that we choose in this stage are going to be dependent on the activity, so if we're looking at running, we would start with a double leg hop and progress to a single leg hop because that most similarly replicates what we're going to experience when we return to play.